Hey, let's welcome to the conversation Dr. David Klein of the Stages of Life Institute. They're right there in Longwood, a suburb of Orlando, not too far away. And for anybody, this is a great place to go. You can also go online. Robin will talk more about that in a few minutes. But right now, the doctor and I get together every single day. We come on the air for 10, 15 minutes. And today we're going to talk about something that everybody seems to be enjoying right now, and that is the pollen that's on our cars and in our air filters and our cabin filters in our car. Most people don't know they have those, Dr. Dave. You knew that.
Oh, but they do need to be replaced, do they?
Yes,
not?
they do. But right now, people are sneezing, coughing. It looks like they're crying. I've got water running down my cheeks at this very moment. Allergies upon allergies upon allergies. But what can we take that's not going to slow us down and do harm to other parts of our body?
Well, welcome to Central Florida. Okay, it's no different here than it is, let's say, out west and so on and so forth, where we have an abundance of plant material, hence the state name Florida. It comes from the plant material that we're all going to enjoy here, probably until the first frost of next year. So it works a little something like this. Okay, the plants reproduce. They do so using pollen. Okay, we all remember this from our biology classes and so on and so forth. But we promptly forget it until we become allergic to it. And these little particles, which are in fact visible to the naked eye, okay, aggregate into these yellow and sometimes grayish looking mounds on your car. And were it not for the fact that you cannot make a tasty tea out of it, this stuff is a dreadful experience. It does nothing but cost you money and aggravation. It's going to clog up the filters of your house, clog up the filters of your car, your air filter, and again, your cabin filter, which must be replaced about every year or so, or you're going to stay sick. And so what do we do about this? Okay, so these little particles float around. They land on your windowsill. They land on your windows. They land on your vehicles, and it doesn't really matter. You hose it off. You see this yellow stuff will go into the ground. Everybody's happy. However, bits and pieces of this end up in your nose, they end up into your lungs, they end up under your eyes, and they set up an inflammatory reaction. And if you are allergic to them, you may not be allergic to them now, but you may well become allergic to them because each and every exposure increases the likelihood that you will develop an abnormal response to these tiny little particles. And they change plant to plant. Each plant has a different protein mix. Each one has a different allergy profile attached to it. So some people have ragweed issues. Some people have oak pollen issues. Yes, oak do have pollen issues. You may not have experienced that in New Jersey, but we sure as heck have it here. And pine trees, oddly enough, really are nasty. And were that not enough, if you really want to experience pollen allergies, get yourself a couple good palm trees, because those puppies really pump it out. So what happens is this. You wake up with a headache, your nose is running, you have a raspy voice. We're all going to experience this season. So what do we do about it? You don't really care about the biochemistry, the 30 or 40 different inflammatory cytokines and other chemicals that get released when these pollens hit. You're going to focus on taking the over-the-counter antihistamines and think that you're doing something good for yourself, and you'd be wrong on both counts. Drying agents don't work particularly well for these sorts of allergies. They'll make you feel a little bit better. They'll clear out the nose just a little bit. Then comes the fun and games, because as you start to dry out the mucous membranes, you can't clear out the junk your body's trying to get rid of. So, the weepy eyes is to try to wipe the stuff off the cornea and off the conjunctiva. The mucus in your lungs is an effort that the body has to clear it out of the bronchi. Your nose is running because your body doesn't really want it in the sinuses. So what genius is going to go out there and take an antihistamine or an anticholinergic? They line up at Walgreens. Okay, there they are buying all manners of antihistamines because that's what your parents did for you because they didn't know any better. Now you just learned something. Okay, what is so awful about an antihistamine? Well, there are lots of things, actually. Some are rare and some are really very, very common. The most common of all issues with antihistamines and anticholinergic medications that you can buy over the counter now is that they can induce symptoms that are remarkably similar to Alzheimer's disease.
No.
So if you're of a certain age, and if you have a certain consideration or a certain family history, really the very last thing that you want to do is to take an antihistamine. Why did I walk into that room? I walked in here to get something. I can't remember what I walked in here for. Well, welcome to the world of the individual with early Alzheimer's. You may not have it, but it sure as heck mimics it. Now, if you've got a family member that has Alzheimer's, you'll recognize the medications that are used. These medications are all prohistaminic. Think about that for a second. What makes Alzheimer's a little bit better? Giving them more histamine. So what was the last thing that you want to do with somebody that might have Alzheimer's or might have some other type of dementia? Give them an antihistamine. Here in Florida, it seems to be good sport. We'll go ahead and we're going to give it to folks just to amuse ourselves. So my advice to you, my advice to your family, my advice to your doctor, if your doctor is listening, is to get everybody off these over-the-counter antihistamines and get them off the prescription ones as well, because they're every bit as bad, if not worse. Now, many of the medications that people use to sleep are actually antihistaminic medications. Or anticholinergic medications, almost as bad. So what you need to do is you need to look at them, and if these medications have as a side effect dry mouth, dry eyes, guess what? It's probably not going to work well for you if you're over, let's say, the age of 60. Now, the good news here in Florida, we have very few people that live that long. No, it attracts people of this age. Why? Because it's nice and mild here. It's a nice place to live. Okay, but you need to understand that alligators will bite you. Snakes will bite you. Little spiders will bite you, and so will pollen. The difference is that you're the one with the teeth. You're the ones that's going to take a bite out of yourself. So what do you do about these allergies? Okay, if you can't take antihistamines, okay, you can't take anticholinergics, what can you do? My go-to medication for this is called quercetin. Now, quercetin is a non-antihistaminic antihistamine. Go figure this one out, which is another way of saying it's not a phenothiazine. You don't really need to know the details of it, but this stuff stabilizes the membranes and mast cells so they don't degranulate. This stuff is very, very inexpensive and is essentially devoid of side effects, and oddly enough, there seems to be evidence to show that quercetin may actually reduce your risk of cancer. Go figure that one out. So if you had to take something to treat an allergy, why not take one that gives you a salutary side effect like decreasing your risk of cancer? Go figure that one out. Go to PubMed. You'll see it for yourself. Quercetin and cancer. Search it. It will do well for you.
A few times during our 2 or 3 years that we've been on the air together in various stations, you have mentioned and done a downer on the neti pot. Well, this very week, we mentioned it last week on the show, just in passing. Well, I didn't. I'm not going to do that. I listen to Dr. Klein. I follow his all direction. But last week I was in the Villages and somebody heard a snippet of our show, and I think one sentence was dedicated to do not use those neti pot things. And this woman came up to me, and she was all enraged, just like the fibromyalgia
of course,
lady.
It's a poor me
and she came up and said, I depend on that, and I really need it. And I said, well, I'll ask the doctor what the problem is, because there is a problem.
Well, the problem is something like this. When you're using hydrostatic pressure, as you do with the neti pot, you're actually pushing the pus back into your nose and into the sinuses. It's absolute genius, okay? Your body is trying to kick it out. I'm telling you not to dry it so that it can kick it out, and folks that use neti pots go out of their way to shove it back in deeper and farther. It makes absolutely no sense. You can't really irrigate out a sinus with a neti pot, but you sure as heck can shove stuff back up in there. It's almost as smart as taking a Barbie doll and flushing it down your commode. If you don't think that that's going to cause you an expensive plumbing job, just wait. These neti pots really aren't very good. If you really want to treat a sinus issue, you do this. You take N-acetylcysteine, NAC, my go-to medication, something called guaifenesin or generic Mucinex. If you want to spend more, you get the brand name. It works just fine. And you take one of each 3 to 4 times a day with a lot of water. Drink plenty of water, and your body will blow the goo right out. It'll do exactly what it's supposed to do. If it's in your chest, it will come out. If it's in your sinuses, it'll come out. If it's in your ears, it will come out. And oddly enough, the main side effect of that is it will clear your gallbladder, liver, pancreas, and if you have one, a prostate. So it is a marvelous approach to this. Does it work? Yeah. Buy a neti pot? No way. That's just me. I'm a very practical kind of guy.
Isn't there a larger chance, just as a man on the street here asking a question, if you're taking water and putting it into a container of any sort, aren't you standing the chance of maybe having that water contain some germs once it's in something that may not have been cleaned properly?
Well, you think? What about
So you shove that in your nose?
Oh, absolutely. Okay, you're assuming that people read the instructions and sterilize the containers, but they don't any more than most people don't sterilize their toothbrushes. Okay, so you brush your teeth, you stick it down someplace, and you just kind of hope that cockroaches don't walk all over it, right? Okay, they do. Flies, they love it. The fact of the matter is that any time you take water and shove it in something, you'd better make sure that it's darn clear or that it's bacteriostatic. Very, very important. What about those vaporizers we used to use?
Oh, God.
They were very popular until people started coming down with Legionnaire's disease from them because they didn't realize that it really meant clean it with bleach between each and every use. That's the way these things have to go. Unless you shove your neti pot in toto into the washing machine or into the dishwasher, it's not going to get cleaned or sterilized. Most people aren't going to do that, and then they're going to get sick. And then God help the idiot that's going to borrow somebody else's neti pot.
Oh, God.
That person deserves to die of infection.
Oh.
I mean, stupidity is what it is. So what do we do for these allergies? N-acetylcysteine,
Right.
guaifenesin, quercetin. Okay, we have a quercetin product at the office called Allergy. It's marvelous stuff. We have one called Sinitrol, marvelous medication. They're combinations for those individuals that need a little bit of this or a little bit of that. But you can piece it together yourself, and it works out just fine. What else? MSM, methylsulfonylmethane, which is an anti-inflammatory. It works for arthritis. So guess what? You'll take care of your sinuses, you'll take care of your earache, and you're going to take care of your arthritis as well. Guess what? That is my kind of BOGO.
And we need to make connections with the stages of life.
Our phone number is 407-679-3337. Our website is stagesoflife.net. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And our office hours are Monday through Thursday, 8 to 5. The health store is open during those office hours, so do come in and see what we have to offer you and all the nutraceuticals that Dr. Klein talks about. We are also on Facebook at Stages of Life Medical Institute.